Hello everyone, my name is Enrique and I will be presenting our study entitled Mobile Application Model for Supporting In-Wound Treatment. So I will start talking about skin wounds. Skin wounds are injuries characterized by the disruption of the epithelial tissue. Skin wounds could be produced intentionally, accidentally, or from pre-existing illness. The treatment of wounds is a process to promote healing, infection, and pain control, and it's important to say that the skin healing occurs better in an environment that favors the cell's growth. When we talk about the skin wounds in a hospital environment, there are patients with traumatic surgical and pathological wounds in their beds. The health team in a hospital, which includes the hospital dressing committee, doctors, and the nursing team, acts in the treatment and monitoring of wounds through continuous assessments to determine the patient's healing and recovery progress. In the wound treatment process, the nursing team periodically collects the patient's information and makes reports for all those involved in the treatment in the wound treatment to follow its progress. In cases where it's necessary to apply a dressing, the hospital dressing committee defines which dressing should be used by the nursing team. But in a hospital environment, the wound treatment process is conducted using printed or electronic forms. In some cases, the nursing team fills out the form with information about the patient's wounds and passes them to the electronic health record. This process can lead to transcription errors and delay accessing data by other health professionals involved in the treatment. Another relevant issue faced uh, is the wastage of dressings. For instance, when the doctor visits a bed, he usually opens the patient's dressing to check the recovery progress. Unfortunately, these actions increase the risk of wound contamination and can lead to a hospital infection, delays the patient's recovery, and increase the workload of health team. In addition, whenever a dressing is opened, it's necessary to replace it with a new one, leading to the nursing team's waste of material and time. So, facing the wound treatment context in a hospital environment, we designed a mobile application model for supporting the wound treatment so that professionals can collect data, produce reports with wound photos, prescribe wound treatment, and track the treatment to support the decision making by the hospital dressing committee and doctors. Now, I will show you the method considered in this study. Firstly, we have based on printed forms obtained from three hospitals of Londrina City in Brazil. We structured the form containing wound treatment details, considering an intra-hospital workflow and patient and wound data registration. The applicability is intended for doctors, dressing committee, nursing team, comprising patient data, offering a complete wound record with prescription, reports, and photos of wounds. So we consider this hospital workflow, which is based on public hospitals of Londrina City in Brazil. As you can see, the patient with a wound is consulted by a doctor and by the dressing committee. After the consultation, the health professionals talk to decide the suitable treatment for the case. After the decision, the type of dressing and medications are prescribed. The prescription is forwarded to the nursing team to proceed with the treatment. And here, the nursing team collects the one information, writes reports of patients' treatment in the medical records. The doctor and the dressing committee follow the reports to check the progress of the treatment. After analyzing the wound forms obtained from the hospitals, we defined the main features of the application, such as user management, patient registrations and admission, evaluation, control and treatment, wound registrations, wound treatment, and report. As highlighted features identified, we can see the map of wounds in different body regions and classify the risk and severity of each one. We also considered the information sharing between the medical and nursing staff, medical consultation, and evaluation by the dressing committee. Uh, we can see it, the data organization through the conducts recording, reports of the history of wounds in text and image format, and tips to users by tapping health icons on the screens, which exhibited definitions of terms, tutorials, and treatments to guide the user. Now, I will show the prototypes of our application. On the left, we have the user management, which allows the registration of different professionals such as doctors, hospital dressing committee, and nursing team. In this module, the user will log in validating its credentials. Also, there is an administration account that will be able to manage all users of the application to accept or not the newly registered accounts. Only after the acceptance by the administrator, the user can access the application features. If the user forgot his password, there is a password recovery interface. In case of forgetting the password, the user can request a reset via link sent to the user's registration email. In the middle image shown here, we have the interfaces of patient registration and admission, which allows the registration of patient personal data, health data, personal habits, disease, and pathological history and other factors that interfere with the healing of wounds. On the right side, we have the Open Admissions Monitoring Panel, which allows to refine the search for patients undergoing treatment according to the unit, room, and bed. It also allows searching for patients by their risk rating of wounds. Finally, allows clicking on the patient's name to access the patient options menu. Here on the left side, we have the patient's menu. Depending on the user type, the application will provide specific options to the professional. In register exam results, the user can register results of exams. In the treatment visualization, allows to consult the treatment reports and consult reports prescribed daily by the different professionals. On the right side, we have the panel of prescription of treatment, which is only accessible by doctor, nursing, and hospital dressing committee. In this panel, all data about dressing should be filled. These two screens are related to wound registration. The screen on the left side allows register a new wound, editing or deleting a pre-registered entry. The wound registration data also allows to select of the wound location in a body illustration and take camera photos from the patient. Finally, we have the screens of wound treatment, which allows the registration of the treatment used according to the conduct's prescription. At the right image, we have a standardized report previously generated by the app containing the data filled. It's, import, it's possible to edit this report if needed. Several other prototype screens can be viewed by downloading the Adobe XD file available on GitHub. Going to my final words, we believe that this application can improve the monitoring of wound healing using photo history and reports, increasing patient safety due to less manipulation of dressing, and also it could reduce the wasting of dressing material. We have implemented a mobile app which supported both Android and iOS platforms using the React Native framework. If you get interested in this project, the source code is available in a GitHub repository, which can be accessed by at these two links. As future steps, we still have signed an agreement with the Hospital of Cancer in Londrina City and adapt our application according to the hospital's workflow. Integrate the mobile app with the electronic patient record of the hospital and improve the user experience of the app. And also in our implementation, we didn't apply any security approach to keep patient data security yet. So we need to apply security policies and techniques to allow our application to be usable in a real environment. Uh, I would like to thank you for your attention, and if you have any doubts, don't hesitate to contact us. Thank you.